Children have their own doctors, pediatricians. But did you know they also have their own surgeons? Hello, I'm Dr. Sudha Reddy, a surgeon based in Hyderabad. And today I want to introduce you to someone very important, a pediatric surgeon. But why does this specialization even matter? It does because children are not small adults. Their organs are smaller and more delicate. Their anatomy is different. And the way their bodies respond to anesthesia, to medicine, to procedures, and to recovery is completely different from an adult. A pediatric surgeon is specifically trained to operate on children, different diseases, different techniques, and a completely different understanding of how a child's body works. And the conditions that bring a child to surgery are often completely different from those that bring an adult to surgery. Now, as a surgeon, I see children at various stages of a condition. Some come early and things are usually pretty straightforward, but some come later than they needed to. And that's when things get complicated. The reason for the delay is almost always the same: not knowing what to watch for, or not knowing when something needed more, then wait and see. That's what this video is about. So let's start with one of the most common and one of the most alarming situations parents face: something swallowed. Toddlers swallow things. It happens. And most of the time, small objects pass through safely. But there are three things that are different and potentially dangerous, and all parents should know about this. First, we have button batteries. These are small round batteries in remotes, in toys, or in key fobs. Most parents think of them as a choking hazard, but they have another danger to them too. If a button battery gets lodged in the food pipes, it causes a chemical reaction, and that can cause serious internal damage within hours. There might not be pain initially or no obvious symptoms, but the damage is happening. This is a surgical emergency. If you suspect this, go to a pediatric emergency immediately. Do not wait, do not give food, do not give water. Second, magnets. Now, if it's usually one magnet, it can be managed with observation. But two magnets, swallowed even separately, can attract each other through the intestinal wall, and this can cause serious internal damage, and parents usually don't know that this is possible. If you're not sure how many magnets were swallowed, go immediately. Don't wait. Third, we have coins, the most commonly swallowed objects. Most pass safely, but if a coin gets stuck in the esophagus, it will not pass on its own. Watch for persistent drooling, gagging, refusing to eat or drink, chest discomfort. If you see any of these symptoms, seek medical help immediately. And for any swallowed objects, the warning signs are essentially the same: drooling that won't stop, difficulty swallowing, chest or abdominal pain, difficulty breathing, or repeated vomiting. When in doubt, seek medical attention early. Let's talk about something that becomes much more common during the summer holidays. More time outside means more running, more climbing, more exploring, and more falls and injuries. And the most important thing I want to tell you is this: stay calm, because your response in that moment is what shapes everything that follows. First, let's talk about head injuries. A fall, a bump. Your child cried and then seemed fine. Seeming fine does not always mean that everything is fine. Over the next few hours, watch for vomiting more than once, unusual sleepiness, seizures, unequal pupils, or any loss of consciousness. If you see any of these, go to a hospital immediately. Now let's talk about limb injuries. If after a fall, a child is not using a limb or is crying when the limb is touched, do not massage it, do not test it for movement, do not try to diagnose. Children's bones are more flexible, and a fracture can exist with no obvious signs. The response is the same if it's a fracture or not. Immobilize, keep the limb still, and get it assessed. Third, we have wounds. I know wounds can be scary, especially if there's blood. But focus for just a moment. Your child is more scared than you probably are. Clean with water, apply firm pressure, and hold for 10 minutes. If the bleeding doesn't stop, it's deep or gaping or something is embedded, seek medical attention. For injuries with rusty objects, a tetanus shot may be needed. Keep your vaccination records handy. Next, we'll talk about burns. Run it under cool water for 20 minutes, not ice. Cover it loosely. Seek help if the burn is larger than the child's palm, or it's on the face, hands, genital or feet, or if the skin looks charred, white or burnt. All across these, the message is calm. is the same. Stay calm, do what you can at home, and when something doesn't feel right, go to your pediatrician early. In part 2, we'll cover stomach pain and two other conditions that are often caught late but very treatable if they're caught early. This is Kavach. I'll see you in part 2.